Hey everyone, David Holt here, owner and founder at Holt Law, the law firm built for healthcare businesses. Today I want to talk about MSOs and MSAs. And just to work through the acronym, an MSO is a management services organization, and an MSA is a management services agreement. It's what the MSO uses to sign with the medical practice usually. Now, these are a very cool way for people who are not licensed healthcare professionals to get involved in medical practices, healthcare practices, and only do the non-clinical things. They have evolved rapidly over the last few decades into one of the most commonly used tools to actually grow and run a medical practice. And this isn't just for, massive private equity investors. It is for anyone, small business owners looking to get into the game of all of the stuff that physicians and nurses and medical practices do, because generally, very similar to attorneys, physicians are not great at all the business stuff. And I mean that with sincere love of physicians and other attorneys. But we were trained to be lawyers or doctors or our chosen profession. Generally, we didn't go and get a bunch of business training and MBA and learn how to do marketing and scheduling and billing and all this other stuff that comes with running an actual practice. And that's okay. The cool thing is we got an MSO, MSA ready to go. So high level, what's happening with an MSO is it's a separate company that you can even have healthcare professionals own. And what it does is it signs an agreement called a management services agreement down with the medical practice or, clinic, whatever it is, something that's owned by healthcare licensed professionals. Money flows up to the medical practice for the procedures that are done. And then money flows over to the MSO for doing things like all of the back office stuff that the physician doesn't want to do, the billing, the management, the marketing, sometimes even the management of the staff, the payroll, all the junk when I'm not actually doing a procedure needs to be done to make the business successful. These are one of our most popular practice areas because they're so effective. And what's cool is that you can mix and match who's up in the MSO, who's down in the medical practice. And so we can have friendly arrangements where the physician is down in the medical practice and up in the MSO, maybe with their partner, maybe with some friends, maybe with other people, but they're in a little bit more control. Or we can have all sorts of setups so long as we are recognizing who can own the medical practice, generally only medical people in most all states, and then who can be up in the MSO. Anyone. It could be investors, it could be you, could be me, could be a physician, it could be 20 people, could be one person. Does not matter. And that's what's cool. What's also really cool about an MSO model is that it's very scalable as a business. You could just be doing a few things for each medical practice and receiving a payment for that. What we do at Holt Law is we help you navigate this because there are some unfortunate, strict regulations at both state and federal level about fee splitting and just corporate practice of medicine doctrine, what's clinical, what's not. When we're dealing with ownership of an entity, it's not necessarily very straightforward. And the MSA agreement itself, it's not ownership, remember, but it kind of looks and feels like ownership. So it's a big agreement and there's a lot to go through and just explain and decide from a strategic perspective. But I love MSOs because, like me at my law firm, I'm good at certain things and I stay in my lane, but I like to delegate and have vendors and those who are very good at business things help the firm with business things. It's the same for a medical practice. So please utilize our expertise. We're here to chat. I'm really excited to connect with you. This is Holt Law, the law firm built for healthcare businesses. You can visit us at djholtlaw.com.